Hello friends. Hello friends. This is Vinita Sinha. I am a certified nutritionist. Today I'll be talking about triglycerides. What it is and how should we bother about it and what should be done. What are triglycerides? Actually, if you've been keeping an eye on your blood pressure and cholesterol levels, there's something else you might need to monitor: your triglycerides levels. So whenever you get your lipid profile test done, you will get the results of triglycerides. So having a high level of triglycerides in your blood can increase your risk of heart disease. But with lifestyle changes, you can of course reduce it and bring it back to the lower levels. So what are triglycerides? Actually, triglycerides are a type of fat, a lipid found in your blood. So when you eat, your body converts any calories it doesn't need to use right away into triglycerides. So the triglycerides are stored in your fat cells. Later, the hormones release triglycerides for energy between meals. So if you regularly eat more calories than you burn, particularly from high carb foods, you will definitely have high triglycerides. This is also called hypertriglyceridemia. So what is the levels that is considered to be normal? A simple blood test can reveal whether your triglycerides fall into a healthy range. So the normal is something between less than 150 milligrams per deciliter, and borderline is 150 to 199, and high is considered to be above 200 to 499, and very high is 500 milligrams per deciliter or above. So generally we as nutritionists also, whoever comes to us for obesity or weight loss, we definitely ask the person to get their blood test done, especially the lipid profile. So the lipid, and that's where we find the culprit, which is because of the triglycerides. So again, there might be a confusion about what is the difference between triglycerides and cholesterol. So triglycerides and cholesterol are different types of lipids that circulate in the blood. So triglycerides actually store unused calories and provide your body with energy, and cholesterol is used to build the cells and certain hormones. So this is the difference. So why do high triglycerides matter? High triglycerides may contribute to hardening of the arteries or thickening of the artery walls, which increases the risk of stroke, heart attack, and heart disease. So extremely high triglycerides can cause acute inflammation of the pancreas also, and that's where people with high triglycerides also have blood sugar levels that is high. So high triglycerides are often a sign of other conditions that increase the risk of heart disease and stroke, including obesity, metabolic syndrome, a cluster of conditions that includes too much fat around the waist, high blood pressure, high triglycerides, high blood sugar, and abnormal cholesterol levels. So high triglycerides is also a sign of type 2 diabetes or pre-diabetes. So metabolic and also metabolic syndrome are condition when the high blood pressure, obesity, and high blood sugar levels occur together, so increasing your risk of heart disease. Then low levels of thyroid hormones, hypothyroidism, and certain rare genetic conditions that affect how your body converts fat to energy. So sometimes the doctors will give you different kinds of medications. It could be diuretics, estrogen, progestin, retinoids, steroids, beta blockers. So these could be some of the medicines, statins that the doctor might give you. But we as nutritionists, we do not interfere with the doctor's advice. Let the doctor give whatever medicines they are supposed to give. we as nutritionists focus on the nutrition component, the nutrition angle of to treat triglycerides, to lower down the triglycerides level. So I will definitely advise you to have a healthy lifestyle, and the choices that you have to take for a healthy lifestyle is exercise regularly, at least for 30 minutes of physical activity almost every day, and avoid sugar and refined carbohydrates. So refined carbohydrates meaning maida, and the very fine carbohydrates you should avoid. And fructose, which can also of course increase triglycerides, and try to lose weight. So if you have mild to moderate higher triglycerides, focus on cutting down calories. So extra calories are converted to triglycerides and stored as fats. So reducing your calories will reduce the triglycerides. And choose healthier fats. For example, don't have trans fat. Have salmon omega 3 fatty acids, and avoid trans fat or foods with hydrogenated oils or fats. Limit the intake of alcohol, because alcohol is actually high in calories and sugar and has a particularly potent effect on triglycerides. So the doctors will definitely give you statins, fibrates, these medications, and of course we as a nutritionist, as I am a nutritionist, I will definitely recommend omega 3 fatty acids, fish oil, which will help you reduce the triglycerides level. That's all for today, friends. Thank you.